all the incontinent-related issues, the dermatitis, the UTIs, all of that stuff, that only puts people into facilities or graduates them up in facilities, independent to assisted to skilled nursing. It's a very neglected part of care. People don't want to talk about it, they don't want to address it, and we can solve all that with a simple spray here, right? We've got a caregiver working with you. It's a very inconsistent process. It's an incredibly undignified process. I don't want to have to wipe anyone's butt. Go to any care facility and ask the staff what the least favorite part of their job is. I bet you 99 times out of 100 it's going to be toileting with individuals. Now, this seat here at its core is an e-bidet. Has the same function as a bidet. Heated seat, heated water, washes the individual. You have a front wash, a perineal wash, and as well as your rear wash. But more than that, they have the option to do a cleansing spray. So it's a pH balanced, neutralizing spray that gets rid of those uric acids, those bile acids that may have accumulated on the skin. Then it will do the water cycle. So it's a much more effective clean. Significant reduction in UTIs in our initial trials, and that's one of the biggest things. Your full tilt is your barrier cycle. It will spray your cleanser, it will do the water cycle, and then it will apply a zinc oxide barrier cream to help re-nourish that skin. Over time, you should potentially get to the point where you don't even need it anymore. Maybe you're only applying it once or twice a week, but depending on your level of potential skin breakdown, maybe you're using it, say, like twice a day, once in the morning, once before bed. The beauty is we're giving that dignity back to the user. But more than that, if we're in a facility, we're not physically lifting the patient, having to do the cleaning aspect, applying those creams inconsistently, or even not thoroughly enough. With this, it's the same thing every time. So I'll give you a quick cycle here. So it senses that the person is on there, and with the simple touch of a button, so your wand comes out, it's hard to see, but it will do a spritz of the cleaner. Then it goes into its wash cycle, and this is programmable. So you've got a lot of different options here. Water temperature, water time, your in-light, seat temperature, dryer time. Now with all that, anybody with any sort of limited cognition, so once the washing cycle is done, we move on to our dryer. There's our barrier, dry it on the skin, and we're all done with Mrs. Jones. So in the rear here, houses everything. We've got a proprietary can. It comes with the sleeve already attached. It can only fit in here one way. You will get about 75 sprays out of one can. So if you're using it twice a day, that's about a little more than a month. Once you get down to that, maybe once or twice a week, you'll probably get 3-4 months out of that can. The cleanser spray comes in a 12-ounce bottle. It's a 12-ounce reservoir. Fill the whole thing, throw the can away. So you won't be able to put anything in there that isn't the cleansing spray.